So in that case, we will inject more on the left side than the right side. So it's soft line max. It's thicker than the soft line. I stabilize my fingers and my hand on the face of the patient. I inject on the deep dermis, and I push with the same pressure on the piston of the syringe, and I see immediately the result. So it's not only the nasolabial fold treatment, but also the wrinkle. You have a fold and a wrinkle, because even if Corinne is very young, she had deep wrinkles. Sometimes the product comes out, but it's not a problem. You can inject deeper, and that's why it's important not to have a lot of puncture. When you want to correct the wrinkle, the superficial wrinkle, it's important to be superficial. And then I correct the folds by the crossing injection, and here I'm deeper. The junction of the deep dermis and the epidermis. This Softline Max is a really fantastic product because it's very homogeneous, and the same pressure you have, the same amount of product you inject. So for me, in my hands, it's really a very easy product to inject. 0.6 cc on the left side, and here 0.4 cc on the right side. Again, I like to start lower, so in case you have some bleeding, you are not in a difficult position. And I ask her to smile because I want to correct deeper wrinkles. And here I inject with one hole. I inject a lot of product with only one hole and with a lot of tunnels. 0.2 cc vertically, and we will do 0.3 cc here, and we'll cross with 0.1 cc. And this is nappage or cross injection. Is really interesting because of the diffusion of the product around the tunnels, and with the fibrosis after the healing process after a month. That's why I can contact the patient and ask them to come back after a month for the touch-up sometime. And you see in the smile, you can also correct the fossette. Some patients, they like their fossette, but sometimes it's interesting to feel them. So the product will go in the tunnels, and with a gentle massage, sometimes a bit stronger, you feel all the irregularities, and because of this wonderful cross-link hyaluronic acid, you can have a very harmonious injection and a very nice contour. It's not only the wrinkle injection, it's really nappage and the contour injections. So we'll see in a month if she needs a touch-up on these vertical lines. Same maneuver on the right side. And this hyaluronic acid is very stabilized. When you squeeze it, you have not, you don't damage it, like we have with other hyaluronic acid for other companies. So we see the results, and she can have some bruising and some swelling,